I wanted to welcome, I wanted to welcome everybody to this conversation. I'm really, really happy that I have a chance to share with you about my experience on this. And also I wanna get to know what you're doing and how we can take this specific need that is now more relevant than ever to reach out to our older adults and to service as part of, a community to not only their needs, but the needs of their caregivers and the surrounding community. I have been in this field for a very long time, since I was myself an undergraduate student. So I have always been passionate about working with elderly. If you need to reach out to me afterwards with any questions or just to share information or maybe to collaborate, I have posted my email on the first slide. Like I said, this is my passion, so I'm really eager to have a conversation about this with all of you. At this point, I'm a faculty member at Miami-Dade College. I work in one of the 8 campuses at the college. My campus is pretty much in an urban community, and obviously most of our students all of our students commute. We don't have dormitories, we're a community college. Most of my students also, for the most part at this specific campus, are minority students of Hispanic background. It's really interesting to see that in spite of the fact that I do teach psychology, very few students are really aware of aging from a lifespan perspective. So that's where I begin. So on the next slide, I always make a point with my classes about why it is important to engage in working with older adults. The first thing is, and now more than ever, I think it becomes evident, is that the elderly are a vulnerable population. Because obviously their income level might be slightly different than most of the population. They might have, in Miami-Dade County, for example, a lot of them have language barriers because a lot of them are immigrants that have come from other countries. So they have kind of age in place. Also, their health has deteriorated. They suffer from chronic diseases. You can see in the news every day that unfortunately the elder population, and I was just talking with my co-host before about the fact that she was mentioning that it's so relevant that now we talk about this, but this is something that in the minds of people like myself that are in gerontology, that study on aging for many years, it has been evident that when you have pre-existing conditions, there's a lot of health disparities that you're going to find, especially in minority populations, like the elderly of African American and Hispanic heritage. They basically suffer more from diabetes too, from heart conditions, and the like. So when they get hit with something like this, like coronavirus, they tend to get more sick than other populations. So I try to make a case for this with my students, especially because I teach a lot of the human growth and development classes. So a lot of them will be going into healthcare in the future. So I want them to be aware that it's not just an issue of education and access to the services, but it's an issue of engaging the community and making sure that whatever programs we offer to them are offered in the more sensitive way, so that culturally they get engaged and they participate, like prevention of, for example, high cholesterol, better nutrition, all of that. So becoming an advocate for the elderly might not be the first thing that our students have in mind. They usually tell me, I want to work in pediatrics, I want to work with small infants. So making them aware that it is engaging, it is fun, it's exciting to work with older people has been something that I have had in mind. Also communicating among the different cohorts. I do a lot of exercises in my classes about, pretending I'm a generation X, generation Y, and my boss happens to be a baby boomer. How do I handle that? Or the other way around, my clients might be, baby boomers and the like. So I really, make them conscious that those conversations, even in the workforce or even in their house, when they speak with their grandparents and just older adults in general, it takes a different connotation than among just people of the same age group. The planning for the future is so important We have conversations usually at a social political level about, social security, about benefits, long-term care, etc. But I always want to make sure that my students know that they could be empowering to not only the older adults, but themselves and themselves in the future, because they will be there at one point when they're going to be 60 and over. So it's to their benefit also to get engaged and to advocate for those things. Right now, for example, the mode that we are looking at everything is social distances, but it shouldn't say social isolation. The American Psychological Association is really championing for everyone to make sure that they don't engage in social isolation. So one of the things that I have done with my students is try to engage them into online service learning, where they can reach out to community partners, and specifically so that they get interested in working with the elderly. Our students are not only change makers today, they are change makers during the crisis and will be change makers in the future. So having in mind, and is the bar graph on the right, that in the year 2030, 1 of 4 Americans will be 60 and over, is so important for them to have in mind, because it doesn't matter what profession they go into, and it doesn't matter what type of service they do in the community, they will be interacting and engaged with older adults. So on the next slide, I have just a couple of things that we are doing at Miami-Dade College, specifically in my campus. Like I said, I'm in the Doral campus, which is in the West Campus, which is located in Doral. It's a very urban community. So we are trying to engage students not only into taking relevant courses that will make them understand a little bit more about aging in general, but also to offer them opportunities for service learning and internships. The second thing that I am really trying to engage not only the students, but other faculty members and staff and administrators. And I thought it would be a good idea, for example, to offer workshops through our CIOL, which is our training and development area, where I can work with them on finding, for example, resources for their older parents, opportunities in the community where if they're aging in place and they're healthy, they could also become volunteers themselves. And last but not least, and most importantly, is engaging those community partners that are serving the elderly for many years into allowing our students to have those collaborations through service learning or community efforts. On the next slide, I have just a sample of what we have done, specifically in my campus. So in here, you see a picture with one of our wonderful faculty members, Dr. Mitchell. She's a music professor. So one of the things that she has already been able to do is engage the students into playing music in an adult daycare. And you can see that the seniors are not only super happy to have the students there, but that they really engage. And these seniors have memory problems. So for them to hear music is not only helpful, but it's also engaging. And at that point, everybody's the same, everybody's equal, and they go home and they, they engage into similar things with their caregivers. Last but not least, I want to say that it's so important for us to engage the seniors at every level, either in a senior center, and that will be on the next slide, to work with them not only in adult daycares when there's impairment, but also in locations like senior centers, the AARP, senior corps, where the students can actually offer trainings or collaborate with them. Some of our students and some of our faculty are volunteers for the AARP. So they offer, service to the seniors where they help them with resume writing and the like. So if they apply for a job in the future after they have retired, they have more of a functional resume rather than chronological. They do role playing with job interviewing and the like. So I want to thank you. This was just a brief overview of what we do at the college. And let's have a conversation about it, just a sample of what we do. Like I said, I have been in this field for a long, long time. I used to be a researcher primarily with Alzheimer's disease and caregivers in Alzheimer's disease, but I feel like serving the community is really what is in my heart. So at this point, I'm a faculty member at the college. I did psychology, but I also advise the psychology club and also a psychology honor society on my campus. So I often wonder why students don't engage more with this population, which is so much fun. So I want to hear from you, your questions, comments. Let's have a conversation.
Yeah, I have a question. It's just like basically that. I'm trying to understand why there is such a disconnect between like the elderly and like you said, it's not a question of like, I mean, everything's always a question of resources, but it's not necessarily that. It's about connection. In your own like perspective, why is that?
I think a lot of it comes from the fact that we mostly live in nuclear families. So it's a cultural aspect for the most part. We're not used to having grandpa and grandma living under the same roof, basically. So a lot of the students don't have that experience. That is an experience that I always speak about. I got to live under the same roof with my four great grandparents on one side of the family and two grandparents. So for me, aging this did not equate to being sick. Aging meant different personalities, different interest levels. So one of the things that I try to include in the conversation with my students is to know that aging, just like with any other group, has a lot of individual differences. So when you say old people, you cannot all equate it to one kind of person that I might be familiar with. So I include in my classes activities such as, can you interview an older adult? And I make a point, I say, somebody that looks at least 65 and over. Initially, when I did this exercise, I had students coming back to me and telling me, I interviewed my mom that is 40 years old and she's about to go into middle age. And I'm like, no, no, no. Middle age doesn't mean old for the purposes of this area. I also try to encourage them to visit senior centers, which are really healthy, aging oriented. We are lucky that in an urban community, we have quite a few. And also engage in different activities. The next big thing that we're going to be doing in our campus, if hopefully after, the COVID-19 happens and goes, over and passes, is that in November, which is Older Adult Month, Older American Month, we want to have like a small summit where we invite not only senior center members, but also some local officials, students from the high schools, etc., so we can have interactive, collaborative activities with them. Many years ago, I used to work in a medical school, so part of the training that we did with the medical students going into geriatrics also was engaging them in aging games, to educate them as to how it was best to communicate with not only the older adults, but to their family members. It's not just prescribing something, a medication, it's explaining it on a level that they can get it, that they can see it and hear it. It's making them conscious. Yes, even if you're healthy, there's going to be those hearing impairments, those visual impairments. So it's a matter of adjusting, just like you meet someone from maybe another country that doesn't speak the language, you can still communicate from human to human, but it's how do you do it? How do you translate that, feeling to that person when maybe the language itself might be different? So it is a challenge, but we try to really do it on a case-by-case basis. I bring, like I said, I don't teach politics, I don't get into politics, but I bring out the fact that, for example, for the last two presidential elections, everybody that is on the ticket at the end is 70 and over. So that's something to think about when you look at Congress. A lot of our politicians that really at this point are making a difference when they vote are over 70 or 65 years old. So if not for anything else, if you want to really be civically engaged, we have to pay attention on who is there, who am I going to write my letters to advocate for things that my community needs. What can I do to make it better, to facilitate that we get the resources that we need, not only at the colleges and universities, but overall. When we have traveled, for example, our students travel to the legislation in Tallahassee. When we meet with our representatives, a lot of them might not necessarily be young individuals. So even that conversation, how do you have it? When somebody's more concerned about, Social Security versus, dollars to pay for my tuition, how do we get to a happy medium where everybody wins in the community? Allocation of funding, opportunities that might happen, etc. So it's really having those intentional opportunities or venues where you can collaborate and you can assist. Right now, like I said, that we are in an online remote mode. One of the things that I'm really encouraging my students is to get engaged in service learning online. And ISED, which is the Institute for Civic Engagement and Democracy at the college, is facilitating those opportunities. And some of them are really, really connected to things like health disparities. So we have, for example, a women's heart and breath initiative where the students go online, they take a webinar, and then they connect to social media to mostly minority populations and how they should be concerned about, having a mammogram, going to their doctor's visits, etc. And a lot of these people are individuals that are 50 and over, or for the most part, 60 and over. I'm working also with a community agency that serves older adults and their caregivers. So the students will be recording readings for them, doing artwork, share yoga, etc. So that, while they are at home, because they can no longer go physically to the daycare, to the adult daycare, they are still engaged and active. Anyone else? Thank you. Any other comments, suggestions? What are you doing in your campuses?
Yes, I had a quick comment for you. So like Chelsea mentioned, it's kind of tough for us at FIU to also get students to feel connected to a cause when it comes to our elderly population. But as you know, in South Florida, we have a huge elderly population, and specifically in our immigrant community. So I specifically am looking to hopefully connect and collaborate with you. So I may be reaching out to you after this. So I'm an assistant director in our Center for Leadership and Service at FIU. So mostly focusing on the co-curricular programming, but we have lots of students that come in looking to fulfill requirements of community service hours or anything related to the courses that they're taking. And so I know of so many like assistant living facilities for adults, and I've tried so hard to get some of our students out there because they tell us all the time, like, we could use volunteers, but we're not getting any. So I'm constantly, trying to track our students down to be like, hey, this is a great opportunity, especially if they're in the healthcare fields or psychology fields or any of those fields of studies would be awesome for them to go out and start getting some of that experience. But it's so hard to get them connected to it. One thing that I saw that started working with some of our students that are super passionate about our Relay for Life program or a lot of our large philanthropies, sometimes we connect those philanthropies to like, hey, there may be individuals experiencing or that have benefited from these types of philanthropic events living at these facilities. And then some of the students have like gotten excited and been like, oh, like I go to Relay for Life every year because of my grandmother or because of a grandfather. And then they're more willing to go out and participate. That's the only thing that I found that like has gotten them a little more excited, about going and doing some of those events. And then I also had some of our hospitality students once do some baking. So they love cooking or anything where they want other people trying their foods. So we did that once, and one of the facilities gave us some like dietary restrictions and things to keep in mind. And the students went and took them some goodies for a little bit. But I'm still like thinking through how can I educate the students a little bit better and like communicate to them the benefits of working with this population. So I'll definitely reach out to you soon. So hopefully we can collaborate, especially since we're neighbors.
No, that would be great. And I'm also, if I may add, I'm an alumni from FIU, so I would be happy to collaborate. And we could even do something like I said, we're going to be hosting the summit in November, so it might be good to maybe, collaborate on that as well. You do have a very close by senior center, which is a Sweetwater Senior Center. So there's opportunities, but I think engaging them in a way that really speaks to them. For example, as you mentioned, particularly in South Florida, and I'm sure in other areas as well, there's the immigrant issue. So a lot of our seniors are immigrants. They have been, aging in place, but a lot of them are not able to communicate in English. Some of them are, but in a limited way. So having to go to sometimes a doctor, to go to an attorney, to do things that normally would be like not a big deal. For somebody in their same age group, for them it would be, especially if their children already left away to college, or if their children are married and outside, especially in some of our minority communities, they're aging in place and they're alone. We have not only the assisted living facilities, but we have just elderly, buildings where they are aging in place, and there's really not many people that they can communicate to outside of that building. We have a lot of issues, especially in South Florida. In the past, I was involved in that research with the Florida Department of Transportation about pedestrian safety, for example, for the seniors, etc. So how can I advocate as a student? I don't necessarily have to, and I tell my students, you don't necessarily have to go and, spend a day with somebody that is an older adult. But if you advocate for some of the causes that are really important for them, then you're making a difference in their lives. So if I'm an engineering student and I know that pedestrian safety is an issue, especially for that population, why not, advocate and research on that and find out what the Department of Transportation can offer you so that you can make your life easier. If I'm for example, a student in psychology, how about, crisis intervention at this point where, so many seniors are alone and they do feel isolated. Just making a phone call, FaceTiming. Maybe your grandparents have friends that are totally by themselves, reach out to them. Do a three-way call with your grandparent and that person. All of those things can be little things. I hear in the news, which I love, any of our students would say, oh, I want to do that. In some universities, students are forming like, body systems where they go and they buy groceries for the seniors and things like that. And I think it would be so great if one student would take the initiative and say, oh, I want to do that, to put themselves out there, is to really go out of their way to help our senior members. Older adults are a really good, transition into what we can see in the future for from the standpoint of the students, because they don't see themselves now as aging, but we all age in place. Many, many years ago, if I may say, FIU had a gerontology degree. And when I was an undergraduate student, I didn't want to have a minor. Usually psychology students have a minor. I didn't want to. I'm very multidisciplinary oriented. And so I had a certificate in gerontology. So I took classes in philosophy, biology, sociology, you name it, everything having to do with aging at the end. And it really prepared me to a job that I had in a local public university, private university doing research. I worked in a center on aging, and every research that we had was in aging, but it was applied research. So we developed technologies that are really technologies to communicate not only the physician and the family member, but the person that is suffering from the illness as well. So I'll be happy to communicate with any of you, to create brainstorming. We can even form, collaboration on this. I think at a change-making level, it's important to form also grassroots, organizations. I formed one many, many years ago as an undergraduate student. I was one of the initiators of the Hispanic Coalition on Aging. And I was very young, I was not old, but I thought that it was important to champion. And I had a chance to sit down with our area agency on aging and collaborate in the wording of the Older Americans Act, a reenactment and all of that. So you have opportunities even for students that are into a major that is not necessarily psychology. I mean, you have political science, international relations. This is an international issue. We all age in place. And right now with the COVID-19, it's even more evident that we need to be there and you need to be supportive, not only to the older adults, but also to their family members, because work-family conflict is there and it's gonna be something that is gonna be there forever. We have people, they always show in the news the mom with like 2, 3, 4 kids trying to work and at the same time tutoring the children. But I think one aspect that the news have failed to show is that at the same time, they may have their senior parents at home, and they have to also cater for them. Sometimes they're not at home, they're alienated in a building, etc., and they have to still bring them food and do things for them. So it's a lot of pressure on the middle age or the slightly less, 40, 30-some-year-old person that might have older parents and at the same time have their own children. Thank you. I think we ran out of time, right, Alexandra? Okay. So I want to thank you all. Please reach out. Like I said, I'm in Miami-Dade College, and the PowerPoint will be made available for all of you after the presentation. It's very brief. I didn't know if I should have a PowerPoint or not, but I figured I would have at least some graphs. You know, 1 out of 4 people in the year 2030 will be over 60, and very importantly, seniors will be in numbers, bigger numbers than the number of children in our population. So we have to have that in mind, that they are there, they're there to stay, and they're there to be able to help us with the things that we need to move forward for the future. Thank you.
Thank you.
Thank you. Reach out. Thank you.